Welcome everybody. We have Dr. Jeff Lowe here just to answer some questions regarding the Omicron outbreak, really just to share his wisdom and some tips in terms of how he's experiencing things right now. I'll hand over to you, Jeff, just to say a few more words, and then I'll just got 3 basic questions to ask you, and we'll keep it nice and short.
Kia ora koutou, ko Jeff Lowe talking. It's great to have the opportunity to connect with the frontline, those who are really doing the mahi at the out in the community. We're experiencing, as we head towards the peak of the Omicron surge, huge increase in the amount of that work that we're doing, both in terms of the response to the pandemic, but also how do we maintain business as usual. And we're really having to draw on all of our healthcare home learnings that we've learned over a number of years now, and that's held us in really good stead. It's my opinion that those who have been on the healthcare home journey pre-wired, if you like, to deal with the pandemic. We've had a number of the components that have been really useful to allow us to have a really agile response to the pandemic. So if you look at factors such as even the morning stand-ups, the whole team meeting, that rapid exchange of information at the beginning of the day, and really developing that team spirit and that support for each other, I think has been really key through the pandemic. Triages are key also. So triage right from reception, being able to ask a few more questions about what people want and need on any given day, through to nurses, through to GP triage, has been absolutely vital when we really have to prioritise who we see on any given day. We've also got all of our communications channels open, going from patient portal to telephone to video consultation to the traditional in-person consultation, and I think that has held us in really good stead through this whole pandemic.
Thanks, Jeff. And so just in terms of how you're coping, in terms of the sheer volume of things, how are you and your team doing?
So, working on the front line can be a really lonely place sometimes, but collegial support is really important. And general practice and primary care is a team sport, so team spirit is vital. So keeping connected with your team within the practice is key, but also keeping in touch with those within the community, not only providers of services, but also through to your patients as well. How a community gathers around this is really important, and we've used certainly social media to be able to do that well, and I think that's given our community a sense of their trusted primary care team, where they have trusted long-standing relationships with the whole team, has held our community in really good stead. But also sharing amongst the wider community. So there are a number of resources and shared learnings from healthcare home practices, which I think have really held people in good stead. For example, the telehealth modules have been really useful. Everyone's already had patient portals and GP triage in place, and that's been a vital, as I say, pre-wiring as we've led into the pandemic, and will hold us in good stead as we move into the healthcare reforms as well. As we've learned from overseas, we've learned from people walking the path of COVID and Omicron before us. We can learn from other regions in New Zealand, and certainly the northern region, and the learnings that we've had from those who have been a few weeks ahead of us have been really important in informing the rest of the country. So that shared learning and that ability to do that in a quick, timely manner has also been useful. It's also felt that we've had those connections through to the ministry and to the minister, so we've been able to advocate for the workforce through this whole pandemic, and that's felt really good as the rate of change has been mind-blowing at times. I think the adage of building the plane as we fly it has never been more apt than during this Omicron surge that we're experiencing currently.
And so what's the biggest thing that's tripping you up right now, if anything?
I think it's sheer volume, and as we try to juggle business as usual with ever-increasing numbers of patients with positive rate or PCR tests in the community is really challenging, because we want to get to everybody's problems in as timely a manner as we can. But all the learnings that we have from GP triage and really triaging right across the team, good use of patient portal allows us to do that. And so we need to make sure we get to those patients who need our help the most on any given day. And we have the tools to do that.
And so obviously there's a lot of advice in there in terms of your sharing, those tips and tricks of some of the, good practices within general practice. And you don't need to be obviously a healthcare home to benefit from all of those. And, there'll be lots of learnings to share, as you say. Is there any other one piece of advice that you might want to give others? And also to finish really is what's keeping you sane and how are you managing your well-being? That's a big question wrapped up in there.
Look, I think, it feels like there's light at the end of the tunnel now as we get through this, and it peaks. There will be some semblance of normal as we get through this. It will be a new normal. What keeps me sane, I think being able to keep in touch with my friends and colleagues in a timely manner, share the anxieties, share the wins that we've had through this whole pandemic as well is important. And just being able to share that experience as we live through what's been the most incredible couple of years in probably most people's medical working life, and to be able to serve our communities actually feels like a privilege. And, we plan to take the learnings from this period that we've gone through and adopt them into the new health reforms as we move forward into the next challenge that we have.
That's awesome, Jeff. Really appreciate your time on this Sunday morning, and really just wanted to capture some sound bites to share with our network to help them through, and using your wisdom and that of your colleagues as well. So really appreciate the time. Kia kaha to you and the team, and we'll see you soon.
Ngā mihi nui.